Smoking is a significant health issue for people living with HIV. Recently, Drs. Ron Baldessari and John Mermin discussed the harmful health effects of smoking for people living with HIV.
Many people with HIV also have other clinical issues. So for example, people with HIV are about twice as likely to smoke than people without HIV. And there are a variety of reasons for that. But at this point, if you take your antiretroviral therapy regularly and you smoke, you're probably more likely statistically of dying from a smoking-related illness than you are from your HIV infection. And so we also need to think about the holistic health of people with HIV. HIV is only one of their issues, and I think increasingly clinicians are thinking of that, and patients should welcome that increased attention to their whole body and mind.
I'm glad you brought that up, Jono, because you probably know there was just a large study out of Denmark showing that men who were in care for HIV disease and were in good care, seeing doctor regularly, had access to antiretroviral drugs, lost more years of life from cigarette smoking than they did from HIV. So we want to remember as public health professionals that it's important to address tobacco issues for all populations, including men and women and young adults living with HIV.
Other studies have shown that people living with HIV who smoke are more likely to develop cancer, bacterial pneumonia, and heart and lung conditions than are non-smokers living with HIV. In addition, studies have demonstrated that people living with HIV who smoke are less likely to stick to their HIV treatment than are non-smokers. Given the poor health consequences of smoking, it is perhaps not surprising that 2/3 of smokers with HIV say they want to quit. If you are living with HIV and you smoke, talk to your healthcare provider and make a plan to quit today.